We wanted to speak to you about the Afib Innovation Program, an initiative designed to better deliver care to both people suffering from atrial fibrillation and support the people who care for them. Afib is the most common chronic heart rhythm problem whose incidence is growing as the population ages. Here's the fib about Afib. The current care system provides the best care for Afib patients. Or is it so? Like many areas in healthcare, we know that providers are doing their best, but we also know that with some changes to the system, we can still improve the experiences and outcomes of patients. Whether people with Afib feel symptoms or not, it puts them at a greater risk of stroke, which in many cases can leave them permanently disabled, or even worse. But it can also be prevented with the right treatment. Here, at OpenLab, we believe in applying a systems approach to solving healthcare problems. We tackle this by looking at the patient and provider experience. In 2009, we interviewed over 50 thought leaders from across the province, from specialists to primary care, and from doctors to administrators, and everything in between. This included engaging important stakeholders who endorsed our work. In fact, Afib made it onto the agenda for the Vascular Health Blueprint for Ontario. By mapping the journey of a patient through the current healthcare system, we could see that it was confusing and disorganized, and that patients were falling through the cracks. However, we could also see the opportunities for improvement, and we ultimately identified 4 unique areas to work on: screening, patient self-management, chronic management in primary care, and management of the emergency Afib patient. Currently, there are no guidelines to help identify undiagnosed Afib, so we took point-of-care ECG technology to key community events to screen people with the goal of identifying the prevalence of Afib. We found undiagnosed Afib in 1.5% of people 75 years and older. In a city like Ottawa, that's about 13,000 people unaware that they are at a higher risk of having a stroke, many of which can be prevented. This early work has stimulated cross-Canada research into screening programs and evaluating the benefit of early identification and treatment. To help patients already diagnosed with Afib self-manage their condition, we created Know Your Colors, a one-page tool developed to encourage self-assessment and advocacy. Patients can see how well they're doing, both from a heart perspective, like is their heart racing or are they having palpitations, and also from a brain perspective, are they on the best stroke prevention therapy for them? The tool was tested with patients and their family doctors, who found it both easy to use and effective in increasing Afib awareness. For clinicians in primary care, we created the Afib EMR Toolkit, which helps them estimate the risk of stroke and bleeding and decide when to refer patients for specialized care. The EMR Toolkit offers guideline-based assessment with easy drop-down menus and checklists that are converted into a chart note, perfect for documentation. Over 90% of family doctors that tested the tool said they would use it and recommend it to others. And with such great reviews, it's no surprise the Heart and Stroke Foundation funded a trial to test the toolkit across the province. Through our mapping, we also learned that some Afib patients don't get timely follow-up after leaving the hospital. So we designed some tools for ED clinicians, and we created a space where these patients can get the care they need. This transitional care model we call the Atrial Fibrillation Quality Care Program. Whoa, that's a mouthful. Let's call it AFQCP for short. The program places a pharmacist and a nurse practitioner at the center of a care team supported by internal medicine, cardiology, and specialty care from an electrophysiologist. Patients get tailored education, standardized assessment, and guideline-based care, and they and their primary care providers also have access to a clinician-managed hotline for support. Early evaluations of the program indicate an increase in appropriate use of stroke prevention therapies, decrease in unnecessary ED visits, and that the patient's quality of life improves. The model was met with such enthusiasm that we created a website where anyone can access our tools, our protocols, the patient education material, and information on how they can implement this program in their own region. It is already implemented across the entire Mid-Toronto West Health Link, and our model even received an Accreditation Canada Leading Practice Award. The fib used to be that the current system provided the optimal care for the Afib patient. But with the Afib Innovation Program and all the impact we've already made, we are well on our way to turning that fib into fact. This work would not have been possible without the contribution of many patients and healthcare providers. We really want to thank them from the bottom of our hearts. Pun intended. For further information, or if you have any questions, please contact openlab@uhn.ca. And if you think this information would be helpful to others, pass it on.